So at this moment, I would now like to call upon the Palliative Care Services Lead of INF Nepal, Dr. Amrita to present us with an overview of the Palliative Care Initiative of Sunita Project and the way forward.
Thank you very much. Good morning, Your Excellency, and all our guests. I'm honored to be here, and especially to be speaking after Professor Rajesh. We're certainly, we've been moved. As he said, let us be going. I would like to repeat that. Let us be going, even as we see all these challenges in our country. And I will be talking about Sunita Project and how it all started and what we've been able to do so far. So taking you through, as Dr. Arun already told you about the history of INF and how it all began, I will not go much into detail about it, but I would like to repeat that ever since the conception of the organization, our heart has always been to serve the community of Nepal. And INF has always catered to the needs of the community, which was leprosy when it started out. But today, as we see the context, we see that Nepal is significantly shifting its disease burden, transitioning from the infectious to non-communicable diseases, with the proportion of 31.3% in the 90s to 71% today. And this gives us an insight on how much palliative care is much needed today, and hence the work at INF-GPH. The palliative care journey at Green Pastures Hospital began in 2013 when Dr. Ruth Powys and Dr. Daniel Monday, who's right here, today's chair, they came to Nepal as non-assigned spouses, and they together worked on a lot of things for palliative care. The training of the healthcare professionals at Green Pastures Hospital started under the leadership of Dr. Ruth Powys, which was followed by the establishment of clinical services in 2016, with 2 dedicated beds at Green Pastures Hospital. And even yesterday, we looked into how the toolkit has been translated into Nepali and the SPICT LIS, which actually helped us to train the health workers in Nepal in Nepali, with the Nepali materials that we could have. And today, palliative care at Green Pastures Hospital comprises of 14 dedicated beds, with 4 dedicated beds for pediatric. And we have integrated palliative care with the management of chronic illness. So palliative care and chronic disease unit at Green Pastures Hospital offers a broad spectrum of services, which not only includes the inpatient and outpatient, but we have very unique services where we support the bereaved families, where we support the community, the patients in the community through daycare services, through home visits, and much more. So we have a diverse interdisciplinary team at Green Pastures Hospital, which made all of this possible, with our therapists, our counselors, and our doctors and nurses, and our support staff as well, which in itself is a service unique to Nepal. And the addition of pediatric and the chronic disease management in 2022 has further broadened the scope of palliative care and improved the lives of many more. So beyond the clinical care, Green Pastures Hospital is actually committed to advancing palliative care through research, extension, and advocacy. And the Sunita Project, which is a 3-year initiative funded by UK Aid and supported by EMS International, is an initiative towards it. So Sunita, the vision, is for people in Nepal needing palliative care will be receiving palliative care near to their homes or at their homes through integrated primary and specialist services and a caring society. The goal of this project is for everyone with a serious, complex, or life-limiting illness in Nepal to have access to palliative care that includes relief of pain, not just physical symptoms, but the psychological, social, and the spiritual distress, and of the family members' psychosocial as well as the spiritual distress, which is in line with the Nepal palliative care strategy, which was drawn out in 2017. So we have the rural palliative care model that ensures access to palliative care, including the relief of pain, like I said earlier, not just the physical, but also touching the psychological, the social, and the spiritual aspects of the patients as well as the families near to their homes. And I will be explaining this model a little bit. In the center, of course, when we talk about palliative care, we are talking about the patients, which are the center of it all. We're catering to their needs, but also they have their families who need our support. And so in the center is the family-centered care. And I will resound with Dr. Rajesh when he said the angels of Nepal, the FCHVs. And I'd like to salute to each and every FCHVs in Nepal. They are the eyes of, a window to how we can identify the patients in the communities. So we have trained FCHVs in different locations, our pilot sites. And then we have also trained healthcare professionals at the health posts, where the FCHVs can refer the patients to. We have trained doctors and nurses at the rural hospitals. From the health post, they can be referred to these hospitals, which will be closer to the homes of the patients in need. And further on, we have our Center of Excellence at Green Pastures Hospital in Pokhara. If by chance, if there is very much a difficult condition, then they get referred to Green Pastures Hospital. And Green Pastures Hospital is also a training center for palliative care, both for adults and children. And we have other training areas in different places, also in schools, where we bring awareness to the teachers and the students about palliative care. And we also have community awareness programs, hoping that we will be able to achieve the compassionate community that Nepal has always had. I will not go into detail about the Nepali palliative care strategy, which was drawn out in 2017, but Sunita project has been is in line with whatever is in the strategy from 2017, and hence we have this model that I just explained. So I would like to share some of the findings that we talked about yesterday. And the exploratory research findings that we found is 2.5% of the population are in need of palliative care in Nepal, which is not homogeneous. For example, we see that only 0.8% of people were found to have palliative care needs in Rukum, but about 3.36% in Lamjung district. And high levels of unmet holistic needs amongst both patients as well as their caregivers were found. And we've been able to achieve our targets from the project as well. And we've been able to train many health workers, including the doctors and nurses and the community health workers, through our toolkit and through our intensive training models as well. We've also been able to train about 409 female community health volunteers and bring awareness in the community in a very, very, very huge number. And we've also been able to train the teachers and students in different schools. And the other achievement that we saw yesterday was also the launch of the palliative care formulary, where our experts have had a great contribution to. And evaluating the impact of Sunita project in delivering palliative care in rural areas, we see that around 10% of the admissions to the rural hospitals have palliative care needs, similar to what our studies show. And there have been improvement in physical symptoms rather than the psychological or the spiritual issues, which in itself makes us want to delve more into it, into the depth of it, why that is so. Because if this is the condition, then our model might fail. Because our main aim is to cater to their needs as a whole, not just the physical aspect. The impact of trainings have been that the FCHBs have been enabled to communicate better, and the rural health workers report that the training has increased the knowledge and understanding of palliative care, reporting that their skills and confidence have increased, especially in communication. And as we reflect on the effectiveness, the model that we see, this rural model, has just started to emerge, which will be more evident with the film that we will be seeing right after this presentation. Excuse me. So health post workers, FCHVs, and Sunita rural palliative care workers are invested in providing palliative care. So we see that people have the heart to do palliative care in Nepal. The communication skills, self-reported, improvement for all groups, all the health workers and FCHVs. We have examples with their interviews as well. So the referral system that we just talked about has been developing, and people are keen on continuing that. But there are challenges of transportation, of terrain, of expectations, which are usually financial from patients and the families, and health literacy is another. And further work is, of course, needed, much, much needed. So hospital system still need to develop, and the model at this point is very fragile. And the rapid staff turnover, particularly doctors, even nurses, is a major issue. And during the project, when we started the project, we had many challenges. For example, we see the fragility of the rural health institutions. We had uncertain changes. Of course, even though the project was for 3 years, the rolling out of the project actually happened for 1.5 years only. But we've been able to achieve this in the last 1.5 years. So the way forward, of course, we've been talking about the national strategy, and we hope and we pray that it will be adopted by the government very soon. Encouraging the local government participation and in line palliative care activities in their plan, and empowering the primary level health workers and encouraging them for palliative care would be the way forward. Thank you very much.